Hello, everyone. Dr. Amanda here. I'm your plant-based lifestyle medicine physician who is here to educate and empower you to make a healthy lifestyle decision so that you can live your most abundant life. Well, we have a special treat today. Dr. J is here with us. So welcome, Dr. J.
Hello.
And Dr. J is a sports medicine physician, and she is here to teach us more about exercise. All right, so Dr. J, let's have you introduce yourself to the audience.
Yes, I'm Dr. J. I'm a board certified internal medicine physician and a sports medicine specialist. And I got interested in sports medicine and more specifically teaching people how to use exercise as medicine so they can prevent chronic disease and ultimately get off of their pills or cut back on their pills. I remember vividly one specific day during my second year of residency. You know, when you just have one of those days and you're at work and you're just trying to get up out of there. It was one of those days, okay? And I went to my bed, which was my place of solace, and I sat on my bed with the covers over my head, thinking that I am very much like my patients, okay? Because just like my patients who felt overwhelmed of being on so many pills, I was overwhelmed of constantly having to refill them or prescribe them, just like them who were sometimes didn't even know why they were taking so many pills. I felt like I didn't know my why. I forgot my purpose. Just like them who sometimes did not feel in control of their health, I did not feel in control of the trajectory of my career. And for me, it was like looking down a dark tunnel with no end. And by this point, I have been exercising very regularly. And one day it just dawned, well, exercise has taught me a very powerful lesson. And it's that exercise is a habit, and we can use habits and implement them throughout various areas of our lives. And that's what I did, but exercise was the impetus for me. So right now, I want to give that same eureka moment to patients and people that I encounter of teaching them healthy habits and how to use exercise as a habit so that it doesn't have to become a chore.
Oh, yes, that is the thing there. Exercise is definitely a chore for some of us. And no matter how much we do it, sometimes it's still that chore. Yes, ma'am. So, can you tell us some benefits, health benefits to actually exercising?
Yes. So exercising has so many benefits, okay? It can help reduce risk of heart disease, stroke, diabetes, hyperlipidemia, even certain types of cancer, such as breast cancer, colon cancer. So it has a vast number of benefits, which is why I'm so passionate of teaching people how to use exercise for their health so that they can depend less on their pills, so that they can depend more on themselves and use that inner strength within them to challenge themselves to exercise.
Yes, yes. Definitely lots of benefits to exercising that I definitely love too. I'm a avid exerciser, try to get things in. Like I said, it builds up so much and helps prevent so many diseases. So I just love that. Love that. Yes, ma'am. So what advice would you give someone who is just starting out on their health journey, and how would you motivate them to exercise?
Yeah, so the first thing I would say is start where you are, right? Because it's so easy to compare yourselves to others. You may look at someone who is, let's say, running in the gym, or you're walking and someone is running past you. It's so easy to compare yourself to others. So realize that you are in your own lane, you're in your own race, and just focus on you and not compare yourself to others, because you don't know where that other person started from. You have no idea. They may have started walking and now they're running. You don't know other people's progressions. So try not to get overwhelmed or down from people who are excelling more than you, because you just don't know where they started. The other thing is to celebrate your wins. Exercise is definitely a challenge, right? There's so many things that are involved. So when you're exercising, for example, you need a couple of things. So if you're starting an exercise program and you're not used to exercise, all right, you're going to need exercise sneakers. You're going to have to create a schedule. You're going to have to be able to create time. So with each win, celebrate it. So for example, if you realize that you want to start walking and you don't have any walking sneakers and you purchase a set of walking sneakers, that is a win. Celebrate that. That is an awesome win. It doesn't have to be a grand win. You don't have to do like 30 push-ups, 40 push-ups to celebrate yourself. No, who wants to do that sometimes anyways, right? So celebrate your wins. If let's say you stay committed to your exercise schedule for 1 week, that's a win. Okay.
Yes.
That means that you have stayed committed to the commitments that you have made to yourself. That is a win. You should be proud of yourself. That is something to revel in. That is a win. So own your wins, no matter how small they are, just celebrate them.
Yes, yes. I so agree with not comparing yourself to others' journey, because I remember I used to do that in the gym. My sister was like a beast, like lifting and everything. And I look at her and I'm like, I'm not lifting that weight. I can't lift that. So definitely, definitely, definitely start where you are and keep going. I definitely agree with
Yes.
that. Yes, ma'am. Let's see. What advice would you give someone who does not like to exercise?
Yes. So the first thing is to identify your limiting beliefs. So why is it that you don't like exercise, right? Because I feel like it does no service telling someone to exercise when they really don't want to exercise, right? Because they're not going to do it. It's just like, no, ma'am. So why? So what is it? Is it that you don't have enough time? Do you feel embarrassed? Do you feel like that you're scared that you're going to injure yourself? What is it? So what is that limiting belief, right? And when you identify your limiting belief, I like to then flip it and then turn it into a positive affirmation. So for example, if you say that, let's say that I don't want to exercise because it's raining outside, or oh, let's say this. I don't want to exercise because the weather is not good outside, right? Because sometimes we blame the weather to not exercising. So you can say that the weather makes no difference if I honor my commitments or not, right? Now now you're placing yourself in a position of empowerment, right? Because you're telling yourself that you are willing to commit to this routine regardless of the weather or not. It doesn't matter. You are committed. You are committed to doing this exercise routine. You are committed to honoring the commitments that you make to yourself. So sometimes when we say something that's negative, it doesn't place us in a position to perform. So in order to circumvent that, you have to change that into a positive affirmation that you actually feel and you believe, right? You have to actually feel it in your heart of hearts, right? That, okay, yeah, I can do this. Like I can definitely do this. I can tell myself that it doesn't matter what the weather looks like. I'm honoring myself and I'm dedicated to honoring myself, so that you place yourself in a position of empowerment and action to get the job done, regardless of the circumstances.
Yes, yes. That is so good. That is so good, because I know there's so many times, especially when I was starting out, I was like, I do not like to exercise. My stepfather used to laugh at me because I was like, I don't sweat. I'm not doing this. So I'll be like, I would go to the gym and come home dry. And he's like, what are you doing? So you have to have that commitment and like get up every single morning. I'm thinking, oh, I'm tired. I don't want to get up. But I'm like, but I got my clothes ready the night before and I set my mindset and I'm going to do this. So
That's right.
that's right. It is so hard. It's so hard. Now I'm going to spin it just a little bit on what you were saying. So you have that commitment, but what if someone keeps coming to you saying, but Dr. J, my schedule is so jam packed, and I don't have time to exercise. What would you tell them then?
I would say, let me see your schedule. Let's do a rundown of your schedule. All right. What time do you wake up? Okay. What you doing after that? But I really just go through a run. I just say, give me an example day, right?
Mhm.
So I say, give me an example day. And we do have pockets in our day that we can make time to exercise. So for example, let's say you're at work and you have let's say you have an hour lunch break or 30-minute lunch break. You can go outside and go for a walk. All right. If you really do have a jam-packed schedule, you can use that lunchtime to go for a walk. Now, another thing that you can do is you can maybe wake up earlier, maybe 30 minutes earlier, to make time before work or before you start your day to put in that exercise. All right. Let's say if you take public transportation, is there a way that you can maybe do like half public transportation and half walking, break it up that way? Or maybe cycle to work, use your bicycle to work. You can do that as well. So you have to be very creative, right? Because sometimes it's so easy, like, oh no, I don't have time. Oh no, there's time, right? There's time. You just have to be very creative. And that's why I like going the rundown of a day and seeing where we could enter little pockets of exercise here and there to make sure that it's in the schedule. And then I tell them to put in your schedule, put it in your phone, get a planner, put a sticky note on your fridge, anywhere you can see, where you can remind yourself, okay, this is what I'm committing to.
Yeah. Yes, that's good. That's good. Definitely, I love it. Put it on your schedule, because like most people say, if it's not on my schedule, I'm not going to do it. So if it's scheduled in, you're going to get that exercise in. That's good. That's good. Let's see. What would you say to someone who states that they are active throughout the day, but they don't really exercise? What's your advice?
Yeah, so let me just start off by just briefly explaining the difference between someone being physically active and someone exercising. So physically active is defined as any bodily movement that is using the contraction of your muscles, right? If you're walking, if you're jogging, or at your job, you're moving, and therefore your muscles are contracting and they're being used. Versus exercise is a type of physical activity in which you're doing repetitive bodily movements to help improve a specific component of physical fitness. Now, to give an example of components of physical fitness, that would be your cardiorespiratory fitness, that would be muscle strength, that would be muscle endurance, that would be flexibility, that would be balance training. So you are performing this exercise to improve some fitness component of your body. Now, I get this a lot of time, and Dr. Amanda, I know you get this too. My job requires me to be very physically active. I get exercise. No, that's not exercise. Okay. You are being physically active. Yes, I agree.
Yeah.
That's great. And definitely some physical activity is better than no physical activity, right?
Right.
But that does not count as exercise, right? Because you're doing the regular motions that you're doing at work. You're also challenging yourself to help improve a specific component of physical fitness, as I previously mentioned. So you want to, while you're doing an exercise routine, you want to perform a repetitive bodily movement that is going to improve a specific component. So let's say you want to improve strength, right? So you can use a heavy weight or a lightweight, depending on your ability. And you want to, for example, do bicep curls. And initially it may be difficult to do because this may be your first time doing an exercise routine such as this. But with time, you want to be able to do more curls and improve or increase your weight so that you can improve your muscular strength.
Mhm.
Okay. And it's important to improve these components of muscular fitness because as you improve them, that also can help decrease the risk of chronic diseases. So you want to be very intentional when
Mhm.
you're doing exercise versus just physical activity. So it's important to know the difference.
Yes, wonderful. Well, Dr. J, you have definitely left us a lot to think about today, and we definitely are going to get on our exercising and not just stay active.
That's right.
We're going to be active, but we're also going to exercise. So, where can people find you if they want to learn more information?
Yes. So I am on Instagram and YouTube, but the easiest way to find me is just on Instagram because in my bio, you could just click on my link tree, and there you will also find my YouTube channel link. So you could click that. And I also have a freebie for you that's in the link tree. You'll see it. And it's entitled 5 Tips to Increase Your Motivation with Type 2 Diabetes and High Blood Pressure. So increase your motivation to exercise with type 2 diabetes and high blood pressure. So there you go.
Wonderful. So we're gonna have to put that in the comments so people can click that link and get to Instagram instantly. So I just want to thank you so much for coming on here once again, and we'll definitely have to have you back and give us some more information about exercise. Okay.
Yes, would love to.
All right. Thank you.
Bye.
Bye.
Is it starting?